I took an in-depth look at pregnant women addicted to drugs. Earlier this year, the Cronkite News Heroin Project exposed the recent epidemic of heroin use across the state. A national survey just last year said heroin use in women between the ages of 15 and 44 jumped from 83,000 in 2012 to 109,000 in 2014. Even more troubling is that some of those women are using heroin and other illicit drugs while pregnant. Every day, Dr. Nathan Lepp treats babies in neonatal intensive care units across Phoenix. Some of them are unwillingly addicted to drugs.
This is a burgeoning epidemic that really has just happened in the last 5 to 8 years that all of us who take care of babies are just now really dealing with every day.
According to the Department of Health Services in Arizona, the rate of newborns exposed to narcotics has increased more than 218% since 2009. Christy Arthur was pregnant, addicted to meth, and unable to stay sober. That's when she turned to a recovery program for addicted pregnant women in Phoenix.
Honestly, I came in because I wanted to just stay sober long enough to have my baby.
Dana Neves, also addicted to meth, checked in at the same time. She didn't know where else to turn.
I never wanted to be pregnant and use a substance. I never thought I would be that kind of a person.
Angela Phillips with Community Bridges Center for Hope works closely with these women and sees the emotional toll.
They feel that they've hurt their baby, their baby's gonna come out with problems and it's all their faults, and now they're fighting not only their previous problems and concerns that possibly started their addiction, but now the concerns of what have I done to my baby.
The women are put on special treatments to kick the addiction. Common detox drugs include methadone, buprenorphine, Subutex, and Suboxone. The Center for Hope uses a methadone treatment program, but that doesn't alleviate the risk of the infant enduring withdrawal symptoms.
A lot of the women who are on methadone and they go to give birth to their baby's going to experience withdrawals.
When babies are born with neonatal abstinence syndrome, they end up in the NICU, where they can remain for an extended period of time.
In a baby, we're looking for signs and symptoms that include inconsolable crying, vomiting, diarrhea, shaking. It can even go so bad as to be seizures.
But neonatal abstinence syndrome is not the only risk these newborns face.
There's really lifelong effects that can affect the child after delivery. So things like cognitive delays or developmental delays, social delays, behavioral problems.
Arthur, a mother of 6, experienced the devastating effects on her children.
I mean, there's a lot of factors that will say, yes, my kids did have side effects from my using.
Arthur says she's put the past behind her.
I'm in a good place. I've been sober for 9 years. January will be 10 for me. I have a really good job. I have a stable house. I'm married. My kids know that I'll be home at night.
And so has Neves.
I now have my bachelor's degree. I'm a director in the position that I work in. I cleaned up my credit. I bought a house. I got married. So now I have, the traditional family, the mom, the dad, the 3 kids, 3 dogs.
According to the 2014 National Survey on Drug Use and Health, over 120,000 women admitted to using some type of illicit drug while pregnant. For a full multimedia report, visit cronkitenews.azpbs.org.